name is Aaron Kim, and this past summer I was talking with my cousin about what I was going to do in college and beyond. And together we discussed everything, all the possibilities. We talked about math, we talked about science, we talked about my interests, and in the end, he told me one important thing, that it was up to me and I had to find out what I enjoyed in life. That is why today I have picked general pediatrics as my topic of study in ISM. So general pediatrics is basically the care of younger children and newborn children, and it focuses primarily on their development and making sure that they overcome any diseases or any sorts of injuries they might have. And before I begin talking about my topic in general, I want to talk about ISM. So ISM is a rigorous class offered by Frisco ISD in which students must interview, and they must go through a selection process they put into the program. And for me, going into the program was one of the greatest things that could happen to me, because I was able to get into so many more opportunities and learn so many new things. For example, I learned how to dress professionally. I learned how to talk to my mentor and talk to people who were well beyond more qualified than I would ever be. I learned to go outside my comfort zone and get what I wanted for myself. And I feel ISM has really changed me in that I now am less afraid of talking to people, and I have more skills on how I know what to do. For example, now I give longer speeches. I can formulate things on the fly. I'm able to, in general, just be a more professional person and be more prepared for the real world. And that closely relates to my topic, general pediatrics, because I feel general pediatrics, we truly have to care for the kids. Doctors have to be able to form a connection with the kids and form a connection with the parents as well. And ISM would be a really great gateway into learning how to hone these skills, because I'm able to truly observe other general pediatricians as well as my mentor and how they themselves go throughout their time. So the first thing I want to talk about is the education of a general pediatrician. And a general pediatrician must go through 4 years of undergraduate studies, and this is usually going through pre-medical classes such as biology classes, physics classes, chemistry classes, organic chemistry classes, and all these classes prepare the students to take the MCAT. And the MCAT is basically the SAT for doctors and medical students. And the MCAT basically is what they're going to do to get into medical school, which would be the equivalent of graduate school for any other type of profession. And for example, so through 4 years of medical school, the doctors will go through their specialization, and then this is when the doctors will learn what kind of doctor they want to be. There's cardiothoracic surgeons, there's general doctors, there's first aid doctors, there's in mind general pediatric doctors, and all these different types of things these new medical students are exposed to, and they can truly learn what they want. They learn, they go through patients, they go through different types of classes, and they learn and observe other doctors, and this is when they learn what they want to be and what they want to do. The next portion is residency. The residency is notoriously the very most difficult part of a general pediatrician or any other type of doctor's pathway to becoming a fully certified doctor. And this is when, in a sense, the medical students become residents at the hospital they are working at. And this is when doctors truly learn to formulate their patient relationships and learn how to deal with patients and learn how to do things in the field rather than conceptually in paper and on assignments. And this is truly the biggest part of when a general pediatrician will learn how to become an actual general pediatrician, and will be exposed to the environment and they will gain experience. And typically, undergraduate studies cost $40,000 to $160,000 a year, depending on the school. And for medical school, it ranges from $100,000 to $160,000, depending on the school as well. And finally, $30,000 to $45,000 for residency, However, in residency, you are also getting paid, so that helps cut back the expenses. And one thing to mention is that the high school you go to helps prepare you for the college you go to for your undergraduate pre-med classes, which, by the way, is not a degree. And the college you go to prepares you for the medical school you go to, and the medical school will help prepare you for the specialization you wish to go to. So in a sense, all these different schools help, in essence, become a domino effect in helping you achieve your goals, which is why it's so important, and why you hear so many people say that this profession is so difficult, because the education is a monumental challenge to overcome. So for high school, lots of general teachers want to take lots of math and science classes, as usual per se, because it relates to the health and the chemistry of the body and all of these things. Extracurricular involvement is another important thing. Colleges want to see that people who wish to go into their programs are more than just studying. They're able to form relationships, they're able to talk to people, and those are both very important things to keep in mind when you become a doctor. Colleges look for good study habits in high school, which will help people easily go through the pre-medical programs in high school and college and in graduate school. And high school is basically just a big setup for college. It's really important to take all these pre-medical classes, lots of AP classes, biology, chemistry, like I mentioned before, and these will really help push and set up the future for the next years to come. And in college, in a similar way to high school, college is filled with lots of medical classes that's similar to biology, organic chemistry, physics 1, calculus 2, biology, as I mentioned before. These are all things that really need to be taken into consideration before taking the MCAT, because the MCAT is such a difficult test that spans so much knowledge that having this knowledge is imperative to understanding what it takes to become a doctor. And pre-med is not a major, like I mentioned before. Pre-med is a sort of classes that one will take before taking the MCAT, which is why many people will pick a different major in addition to their pre-med classes, so they can still graduate with some degree. Good colleges lead to good medical schools. Being in a college that really helps understand and teaches the material really well will help you get into a good medical school that are known for their specific specializations. And volunteering is another big part of college, because medical schools want to see that students are prepared for not only just studies but outside of studies, and talking with patients, being able to work with the organization, work with a different type of groups. And it's important to volunteer and gain experience inside the medical field, because college is a place where you can prepare yourself before you get to the real world. MCAT preparation, just like the SAT, begins junior to senior year, and then students will apply for medical school. Now, medical school is where lots of students will start getting into more medical than broad general things. Students will start learning medical sciences and clinical sciences. So medical sciences, in essence, is basically the book and paper, all the materials, assignments. This is where students will start memorizing anatomy, physiology, all these things that will pertain to the human body before going into truly gaining experience, which is in clinical sciences. And clinical sciences is when students will start dealing with the patients and forming patient relationships, and learning how to talk with them, learning how to create the environment and certain procedures and policies they must follow. And this is the part where students will get the best in-depth look at the medical field before they actually go into residency and actually become a practicing doctor. And this is where students will start learning about their specialization. And for my mentor, his specialization was general pediatrics, and he said he looked at many other types of specializations through surgery and all these other types of specializations, and it was very difficult for him, but he ended up sticking with general pediatrics. And the last portion of the pathway to becoming a general pediatrician is residency. So for the first, residency is usually made up of 1 to 4 years, may even go on to 5 years, depending on how specialized the medical student wants to get. So for the first year, it's 4-week rotations learning about different specializations. Even though medical students learned about specializations before in medical school, this is where students will actually be exposed to these new specializations and will actually have the chance to pick what they want to do and actually learn more about the different options available. In the second and third year, this is where students will go into the clinical atmosphere, and technically students are an actual doctor per se, but they aren't really a practicing doctor if they have finished their residency. And so clinical atmosphere, with their specialization, they will go and they will participate in different types of clinics and different types of meetings with the patient, and they will learn how to talk to the patients, and they'll learn how to form relationships and create new things with the patients. And then the fourth year and beyond, this is really up to how far the medical student wants to go. There are the fellowships, which are basically groups of doctors with similar specializations, and they will form groups and form networks. And also, if, for example, someone is going to a more advanced specialization such as surgery, lots of surgeons take up to 2 to 7 more years than a normal doctor, and it just shows how much more specialized and how many more different things we can get into in this field. So being a doctor, there are 2 separate things about being a doctor. There's private employment and there's hospital employment. So private practices, private employments are basically when the doctor decides to create his own business and will receive patients from himself. And hospital employment is when a doctor will go to a hospital and work with the hospital and treat patients from there. So there are 2 big differences between these things. Private employment, doctors will deal with much more of the business side of things. Doctors will have much more opportunities to have more independence in deciding how they deal with certain illnesses and diseases, but the downside is they also have to manage more things. Or in the hospital, it's basically vice versa. Doctors won't have as much independence as they would like. However, they don't have to worry about anything else except caring for the patient. And this is a very big divide between the two, because both have their pros and both have their cons. A typical workday is 5 days a week, sometimes on Saturday, usually from 9 a.m. to 5 p.m. This is for general pediatrics, because general pediatricians, they're general, they don't deal with lots of special cases, and in turn they will deal with lots of normal cases and they refer them to specialists. And this is why you see a much more regular work week than a different type of surgeon or specialist or ER doctor. And so the best and worst experiences for many people, the best experience is, of course, watching their patient get better, watching their patient grow, watch their patient forming relationships with their patients. And it's truly a different experience having a patient that's not an adult, having a patient that's a child, and it's such a unique experience for many of the people I've spoken with. And the worst experience, of course, would have to be dealing with the loss of the patient, or if the patient's not feeling well, and if a doctor just can't solve the problem and then they're not getting better. These are certain things that really hurt the doctor, because they feel like their job isn't working and it's not helping out anyone. So one unique relationship or concept that I learned about was the patient relationships, and one unique concept was the idea of continuous birth. And this is how doctors are able to watch their patients grow from childbirth all the way until they're 18 years old, essentially an adult. They get to see the patient from child to adulthood, and that's such a unique aspect, because almost all the other doctors only deal with adults, and they only deal with older people, and being able to see the development and the growth of a person is truly a unique experience. And another unique concept was pediatric dynamic. And of course, as children, they cannot communicate well or tell about everything they know, because they're not always the most perceptive. So the unique parent, patient, and child relationship, it's a triangle of the things, is really what helps the child get better or the patient get better in this situation, because the parent has to help tell the doctor what is going on. The doctor has to receive the inputs of both the parent and the child to form his diagnosis and then assign the treatment. And this is something that's really unique because normally it's just two people, but having a third party within the dynamic is extremely unique, and it's a very different concept to deal with than most doctors would be comfortable with. So moving on, after deciding my topic of study, I had to go out and find a mentor through research interviews. So I interviewed Dr. Kutsi Onur, Dr. Ayresh Kumar, Dr. Mee Nap, P.A. Paul Cho, and Dr. Samuel Kim. So the first person I interviewed was Dr. Kutsi Onur, and he is a general pediatrician in the Dallas area. And from him, I truly learned about the in-depth personal life of a doctor, because he told me how general pediatrics and general doctors aren't always as highly regarded by the rest of the medical community because they're just general. They don't deal with any specialization. They don't have any super detailed, in-depth knowledge. And he felt that that was really different from everything else. And he also told me how sometimes there will be odd hours, lots of volunteering outside of his normal workday because he has to go to the hospital and deal with children. He has to go to different places. He has to be on call, ready for if anyone's giving birth or if anyone has a major sickness. He has to be ready for all these things. And this is what really takes a toll on the personal life, and how for him his personal life has been affected because he has less time for his family, for the people he cares about. And this is truly one thing I had to consider, and one thing I had to remember when I was continually going through this field. The next person I talked to was Dr. Ayresh Kumar, and he really told me about why I wanted to become a doctor. He really let me know, made me look in depth why I wanted to go to this field. Because of general pediatrics, I felt he said it dealt with the compassion, it dealt with helping the children more than anything else, and he felt that general pediatrics had the most compassion for the patient. And in this way, I felt the same way as well, because I felt I wanted to help people. I wanted to see them get better, and through general pediatrics, I would be able to do that. I would be able to accomplish my goal. And another thing is, the best thing he felt was leaving people satisfied with their health care, and that's what I truly wanted to do. I wanted to help other people, help people get better through their health, because everyone needs health, and being able to help the most people I could is a truly rewarding experience. The third person I talked to was Dr. Mee Nap, and she's a general pediatrician as well, and she taught me the couple of concepts I told you about previously about continuous care and the role of parents in the patient dynamic. And I really learned about the factors that go into the examination process, because it's such a different field. You deal with different patients than normal, that this is how doctors are able to go into a different field and look into the different aspects of it and learn about the examination process. And the fourth person I interviewed was P.A. Paul Cho, and P.A. stands for physician assistant, and he taught me the role of a P.A. Even though he is not a general pediatrician, he really taught me about the different roles outside of just being a doctor. He told me about the role of the P.A. and how it is a aid to the main physician, and the main physician is, of course, going to be working, and he's going to not always have time to go through and help every single person. And that's why I felt like his job really enlightened the process through it all. And he told me how lots of patients felt that PAs weren't qualified, and this is not true, because PAs are qualified indeed, and many patients don't feel like they're qualified, and thus will not treat them the same way as they would a doctor, which it only creates more problems, and there's lots of mistrust between the patients and the PA. And from this, I truly learned the aspects of running a clinic and how many different parts there are to running a clinic and making sure everything runs smoothly. And the last person I interviewed was Dr. Samuel Kim. And Dr. Samuel Kim is a general dentist, and although he is not a general pediatrician, I truly learned about different specializations in the medical field. Even though doctors start off with the same education, once they get the specialization, it changes. And he told me one unique thing about being a dentist is that lots of people demand perfection from their teeth because the teeth is viewed as a cosmetic part of their body, and the teeth have a special importance in people's lives. And this is why he felt like the perfection demanded could be translated to other fields, and how other fields may also need to bring the same level of determination and perfection, even though it may not have the same idea. So lastly, I settled on my mentor. I asked Dr. Irish Kumar, and he helped me, and through the process he became my mentor, and through him I gained further primary knowledge, I gained further shadowing opportunities, and I had lots of experiences with being with an actual doctor as he's going through his actual day. And it's an amazing experience being able to understand, being able to basically follow someone through their footsteps, through their workday, and it's something I would never have been able to access without ISM. So for my original work, I talked about white coat hypertension, and I talked about the causes, I talked about further understandings, and the causes of white coat hypertension are basically patients' mentality towards doctors are initially fear because they don't understand that they're afraid of getting an illness or a shot or a treatment, and all these things come together to help the patient become scared of the doctor, and being scared of the doctor really interferes with different things. It helps create inaccurate readings and tests, and that can hide symptoms of diseases that need to be treated, and that's why it's so dangerous and why it's much more than just being afraid of going to the doctor. So the purpose of my original work was discovering why people fear the doctor. I wanted to see why people shied away from going to the doctor, why so many people didn't feel like going to the doctor was necessary because they were scared of them. And I wanted to find ways to address the fear and to find ways to make sure patients don't have any more fear, to better create the patient relationships. I wanted to see if any external factors had an input into this syndrome, and I wanted to experience, from my experiences, I also have fear of a doctor, and which is why I wanted to understand these fears and see what was causing them. So with my original work, my purpose was, or my process was, I had to create a set of unbiased questions on a survey, because that's the best medium to reach a large amount of people and gain information quickly. So I had to create unbiased questions to make sure I didn't have any external factors that would interfere with my data. I had to have a large number of participants to make sure it was random enough. I had to make sure I did not have a source of bias. I had to eliminate as many sources of bias as possible. And lastly, I had to create a conclusion for my data and analyze it and search for patterns in between the data and any sorts of new things. So for the research, I had to research white coat hypertension. White coat hypertension is a syndrome whereby a patient's feeling of anxiety in the medical environment results in an abnormally high reading when their blood pressure is measured. And this is an issue because patients having a high blood pressure only in a clinical environment can hide other symptoms of high blood pressure when the patient is relaxed, for example. And lots of studies have been done and have shown that patients who have white coat hypertension, there is in fact a big difference between the clinical blood pressure and the resting home blood pressure. And this is why it's so dangerous, because you can hide so many different things, and it basically creates a lot of waste as well, because patients are giving inaccurate readings, and with inaccurate readings, doctors can't do anything with them. So is it treatable? It's debatable, because there are certain things people can do. Lots of doctors don't wear white coats anymore to get rid of the stereotype. Lots of doctors will talk through the patient, the treatment procedures, and let them know, give them a preview of the pain if there's any, or let them know how it feels. And in a sense, it is treatable, but at the core, it's up to the patient to decide whether or not they want to overcome their fear of being with the doctor. So for my original work analysis, there were two sources of bias. The medium in which I conducted the survey led to two sources the age was mainly high schoolers between 15 to 18 years old, and the gender, it was primarily male. So that might have had a large impact on the findings I found. And I found that regular visits to the physician were not as high as when they were children. However, when they became adults, they began regularly going to the physician, which I found extremely odd because I assumed it would be the other way around, that bad experiences with the pediatrician would lead to less time as an adult with the physician. However, I was wrong in my hypothesis in that aspect. Experiences with doctors were much better than I expected. I initially expected I asked the surveyors to rate the experience from 0 to 10, and in fact most of them put 10 or 7 to 10 range, which was good to great experiences, and I thought that was extremely weird because then I began thinking more about the data I got, and I realized that maybe hypertension isn't as big of a problem as I initially expected it to be. Most people did not have a fear of the doctor, probably in lieu with the experiences with the doctor, and lots of people overcame their fear of the doctor, and which leads me to believe that hypertension is nothing more than just the mentality of the patient, and the patient needing to overcome their own fears and their own past experiences to make sure that they are receiving the best health care possible. And the impact of fear, lots of people said fear had no impact on their checkups, in which I found, again, kind of a little odd because I assumed that hypertension would have some sort of impact on their checkup. But however, because the fear was overcome, I would also assume that fear had little impact on the procedures. And hypertension awareness, lots of people were not aware of hypertension, which also leads me to believe yet again that this may not be as big of a problem as it is, and that lots of patients may also just be able to get over their fear and overcome their mentality and look past any of their expectations and any past experiences to just make sure that they themselves are the healthiest they can possibly be. And so for my final product, in the same way as my original product, I wanted to focus on the patient. I wanted to look at what the patient could do to help make themselves better, because ultimately the doctors can do everything they can, but if the patients do not wish to cooperate, it's not going to help them get better. And I wanted them to look into this gap between patient and wellness. And after talking with my mentor, I began thinking about patient non-compliance and how patient non-compliance is such a big issue for many different diseases such as antibiotics or medication. And I wanted to be able to create something that bridges this gap to help people get better faster without having any misconceptions. For my original work, I decided I would make a video about a common disease that many people mistreat or misunderstand. And for me, that one disease was the common cold. And common cold, there are lots of things, lots of differences. Many people can confuse it with getting the flu, which is a much more dangerous and much more long-term disease. And the cold, lots of prevention ways for the cold and lots of ways to treat the cold, and lots of misconceptions about ways to get the cold. And through all these things, I learned there are so many different aspects of the common cold that people just did not know. And especially for younger children, this can be especially dangerous because their bodies are much more vulnerable because they haven't developed an immune system that is strong enough. So for my final product, I am creating a video that is going to outline all these misconceptions and straighten all the facts out and make sure that it appeals to kids, because I wanted to be able to show it to my mentor's patients in case they ever had any difficulties with this disease. And I wanted to be able to show them a simple video that is quick, informative, and make sure to eliminate any signs, any causes of patient non-compliance. And solve issues of time as well, because doctors receive a lot of questions from the parents on how they do this, how to do that. In essence, I wanted the video to also be a frequently asked questions answer guide to all these things to help the doctor save time to be able to treat more patients and develop more things. And so for my SMART goals, for my goals after high school, I want to be accepted to medical school after receiving my bachelor's degree in my undergraduate college major. I wanted to receive a biomedical engineering degree along with my required pre-medical courses, as I mentioned before, because pre-med is not a major, and I want to maintain a minimum of a 3.75 GPA in college. And I'm just, for my SMART goals, I'm currently aiming for high school, after high school, and once I get to medical school. And once I get on from there, my future plans are to become a doctor and a general pediatrician who practices. And for my quote, this is by George Bernard Shaw. It's, life isn't about finding yourself, life is about creating yourself. And that's truly what I believe in, because through ISM is nothing I found. I was able to go out, I learned about it, and once I learned about it, I wanted to create myself in this program, because I wanted to be able to get these experiences that I've had this year and truly learn everything I learned this year. And this is why I believe that I have created myself to become the best person I can possibly be. Thank you.